Hello again. It's good to have you here. Let me ask you something. Is there a food you've been eating for years, maybe even decades, without ever thinking twice about it? Something you've come to rely on for comfort, habit, or just routine? I ask because I used to do the same. There was a time I would start nearly every morning with one of those easy, grab-and-go meals, fast, tasty, familiar. Until one day, a colleague, also a doctor, quietly asked me, "Have you checked what that's really doing to your arteries?" That question stayed with me. And today, I'd like to gently pass it on to you. You see, as we get older, especially after 60, our bodies become more sensitive to things we used to handle without much trouble. One of those things? Processed meats. Yes, I'm talking about bacon, sausages, ham, deli meats, and hot dogs. I know, they taste good, and they're easy to make, but the science around them is becoming harder to ignore. Processed meats are often packed with sodium, saturated fat, and preservatives like nitrates, all of which, over time, can damage the lining of your blood vessels. For older adults, this can quietly raise your blood pressure, thicken your blood, and increase the risk of clots forming, which, as you may know, is one of the main causes of stroke. And the tricky part, you might not feel a thing until something serious happens. Now, I want to be clear. I'm not here to tell you to throw everything out of your fridge today, but I do want to offer you something more valuable than just a list of bad foods. I want to help you understand why certain choices, when repeated every day, can quietly chip away at your health, even when everything on the outside seems just fine. When I work with patients in their 60s, 70s, and beyond, I always say this: aging doesn't have to mean giving things up. It's about making better trades. For example, instead of starting the day with bacon or processed sausage, try a boiled egg with avocado on whole grain toast. Or swap out that deli sandwich for grilled chicken or tuna with olive oil. These may seem like small switches, but they protect your arteries, lower inflammation, and keep your brain healthier as you age. Here's something else to think about. Stroke risk doesn't increase overnight. It builds slowly, silently. But that also means you have time to turn things around, to protect your independence, and even reverse some of the damage. I've seen it happen. I had one patient, Mr. Grant, 68 years old. He loved his morning bacon every day, but he also had a history of high blood pressure and slight numbness in his hands. We talked, and he agreed to make a few small changes. 2 months later, his blood pressure was lower, he felt steadier, and he told me, "I feel like I'm thinking more clearly again." Sometimes, it really is that simple. I share all this because I care, and I believe you deserve information that's calm, honest, and helpful. Not fear, not guilt, just real, gentle guidance that puts you back in charge. So, if you're still with me, thank you. Thank you for choosing to listen, for choosing to care about your health, and for trusting me to be part of that journey. If you haven't already, I'd love for you to subscribe to this channel. Every week, I share tips like this, simple advice, made for older adults who want to feel stronger, sharper, and safer as they age. And if you've been enjoying this video, go ahead and tap the like button, or leave a comment sharing your thoughts. What foods do you rely on every day? What changes have you tried? I'd love to hear from you. Before we wrap up, here's a quick tip you can start tomorrow. Look at your breakfast plate. Is there something there that might be quietly hurting more than helping? Try replacing just one item, maybe the bacon, maybe the sausage, with something fresh, something whole, something that fuels you better. Your body and your future self will thank you. Until next time, take care of your heart, your mind, and the small choices that add up to a longer, healthier life.